Good morning. I am Dr. Dave Christian Dalida, and I am a nurse and a physician by profession. I would have loved to be there with you today. However, due to an unforeseen event, it has disallowed me to do so. Uh, so let me apologize for that. And let me first introduce myself. I am Dave Christian Dalida, and I am a graduate of the Marikina Science High School in 2007. I then proceeded to obtain my Bachelor of Science in Nursing at the University of the Philippines in Manila, and then proceeded to obtain my degree of Doctor of Medicine in the Pamantasan ng Lungsod ng Maynila College of Medicine. And I became a doctor in 2016. So, as I understand, it is your math month today, and our teachers have invited me to talk to you about the applications of math in my field of specialty, which is medicine. So, as you all know, math is a very vital part of our lives. It is basically in everything that we do. And in our lives, the application of math is a myriad of possibilities. So, from what I do in the field of medicine, math is very important, as you all know. We not only work with numbers, but we work with patterns as well. Not only in the sheets of paper that we answer, but of course in the actual patients that we see. So, the most basic thing that I can tell you is, of course, we need math in computing for dosages of drugs. So, especially in the pediatric population, which I think you are part of, doctors usually compute for the dosage of medications that we are giving the children. So it's not always the same dose for every child. So it's basically based on your weight or based on the type of illness that you have. So again, that may be basic math, but that is very important because that will determine if you are going to be well or you are going to be more sick because of the medication that we are giving you. So that is one of the very, very important application of math in medicine. Also, of course, we compute medications not only for specific illnesses. We also compute for different dosages, especially in anesthesia, in the field of anesthesia. So it is actually a very critical field of medicine because we have to be very precise in our computations, because one mistake in the computation of these medications may lead to debilitation or death of a patient. So in anesthesia, we employ, of course, algebra, we employ basic calculus, and we have to maintain a certain degree of prudence in doing so, because as I've said, it will be very tragic if the computations of this medication is incorrect. And that's why it is of great help for you to have a very good math background. And of course, before all of those things, before you can even get to medicine, you have to be very good in math. And in the different subjects in college, especially in nursing, and from where I came from, in the University of the Philippines in Manila, we have a very difficult set of math subjects, even if they are just algebra, even if some of the subjects that we're taking are simple geometry or trigonometry. These subject matters are really difficult. Oftentimes, we are joking about it, that the math subjects that we're taking are actual master subject already in other campuses, because the problem sets that they're giving us are actually very difficult. So we have to be very good in math, and I have to say, our training there in Marikina Science High School has prepared me very well for our math subjects in college. So now, boasting aside, and I would say that I didn't have that much of a hard time in breezing through our math subjects. So, well, actually, hindi lang math, no? We have also different subjects that employ math, such as chemistry, so which of course you very well know that we employ math in stoichiometry, and other computations in chemistry and in physics. Although we only take basic chem and basic physics, no? So it's not unlike other specialties, or unlike other courses. Of course, they have a very in-depth understanding of these math subspecialties or math subjects. So in nursing, of course, so let me take this opportunity to also talk about nursing. So in nursing again, you are not only expected to give medications, you are also expected to be an advocate of your patient. So you have to exercise a certain degree of diligence when carrying out these orders from the doctors, because you are the advocate of your patient. So when I was in practice, I actually didn't have an actual practice in nursing, but when I was training in the Philippine General Hospital, we usually would recompute for the doses and check if we are giving the correct dose to the patient, because that is our job as nurses, as advocates of our patients. Okay. Also, not only that, you very well know that doctors are not only found in the hospitals. So in the field of medicine, we have a very wide pathway for a young doctor like me. So I can specialize into other specialties such as internal medicine, surgery, orthopedics, pediatrics, and other specialties, and go further into subspecialties such as cardiology, nephrology, pulmonology, and each subspecialty or each specialty uses math in their own respect. So, see, I've mentioned I've mentioned and discussed a while ago the application of math in the field of anesthesia and of course, in medicine. But another field that a physician can go into is public health. So in public health, we have a lot of things in our hands. Of course, as a public health physician or even as a public health nurse, you are taking care of a very big population. So oftentimes you have tens of thousands of population in your hands, and you have to figure out the patterns of diseases in that area, and you have to devise ways in order for you to address these health concerns. So how do we do that? We do not only look and ask people what their disease is. Say for example, as a public health doctor, I will not just go around and ask people, ano po ba ang sakit ninyo? Sige po, may ubo ho kayo. And then I will transfer to another household and ask them, ano po ba ang sakit ninyo? It's not only that. That is very basic, and that is not even systematic. So what do we do? Of course, we have to go back to basics and to gather information. Probably one of the ways to gather information is through asking them personally, just like my example was. And how do we process the data that we are going to obtain? Of course, we use statistics, and I believe that you are also having statistics as a subject in high school. So one tip for you guys, you have to study statistics very well, because in any course that you will take in college, statistics is very essential. So you really have to be serious about your statistics subject. So now, in research, I think in your curriculum in research, you have basic methods of research, and then your statistics 1, and then your statistics 2. So you really have to engross yourself with those subjects, because those are the subjects that will matter very much when you are in college, and even in postgraduate degrees like mine in medicine. So before you graduate college, the institution that you're in will require you to have research. And in order for you to have a very good research, you have to employ statistics. So in order for your research to matter, you have to have data that will matter as well. So in order for you to do that, you have to employ very good statistics. Okay, correct use of statistics for that matter. Okay, so again, that is one application of math. So the use we use statistics in studies. So we couldn't just present you with numbers, because those numbers will be immaterial in the field of public health if they are just numbers. So you have to correlate the numbers with the actual situation of the people that you are looking at. And how do we do that properly is, of course, through the use of statistics. Specifically in the field of medicine, we use it in the field of epidemiology. So we compute for the different risks, so relative risks and absolute risks for certain risk factors that may lead to diseases. So let me give you an example. You very well know that smoking is already attributed to the occurrence of different diseases such as hypertension and cancer. So that's why, well, I admonish each and every one of you to never smoke, because everything that the smoke will pass through your body is at risk of developing cancer. So you really have to quit smoking and tell everyone around you who's smoking to quit as well, because you will be affected. It's not only the person who smokes, but also to the person who receives the smoke, who could be you. Alright, so no, it's just a segue. So going back to my example, we have established that smoking causes can be attributed to the development of cancers in the human body. So how do we say that? Of course, we have different study methods that we employ in order for us to come up with that conclusion, and in order for us to develop that conclusion, we have to use methods of epidemiology. So different study methods have used different epidemiological techniques in order for us to arrive in that conclusion, such as the use of relative risks, attributable risks, odds ratio, depending, of course, depending on the type of study that you're using. So in order for you to conclude a risk factor to be actually contributory to the development of the disease, then you have to find it statistically significant. So that is one of the very important uses of mathematics in the field of medicine. So the use of math in epidemiology. So actually, the field of epidemiology is a math-laden course by itself. Kasi I think almost even the descriptive means of describing your data actually employs math in its basic sense. So it's not only through hardcore statistics. And you have to be very particular with that, because your decisions as a public health physician will depend on these statistics, or the statistical significance of the data that you're getting. Okay, so the decisions that may mean life or death in your population or in your area of coverage will be dependent on the type and the quality of research that you are getting. So I can delve longer on research, however, it's gonna take us several days. So again, suffice to say, math is very important in research and in epidemiology. Okay, and also I would like also to emphasize to you the importance of math in terms of your finances. So it's not only in the what do you call that? It's not only in the actual practice of medicine in its strictest sense, but of course in your life as a doctor. So of course you have to come up with plans regarding your finances. And since we are talking about money, we are talking about numbers, and we are talking about math. So again, this is a very practical use of math in your life as a doctor. So there. So there are a lot more uses of math in being a doctor or in being a public health worker like me. So uh, in any case, you have to be very good at math, because as a doctor, you have to remember that the life of the patient that you are treating is in your hands. So if you are not very adept in 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 the computations, employing mathematics, of course, then it may lead to a disastrous ending for your patient, and that will also be that will also say something about you as a doctor. So there. So uh, thank you very much for listening. And if you have any other questions, you may course it through your math teachers, and I will try my best to answer them all. All right. Thank you. Have a great day and study well.